let's talk about connection breathing. So, connection breathing is something that's super important for anyone, but especially important throughout an entire pregnancy. The reason that we do connection breathing is to stay connected to our core, just as the name would suggest here. Staying connected to our core becomes more and more challenging throughout a pregnancy. The further along you are in your pregnancy, the more difficult it becomes due to your expanding stomach, obviously, hip orientation, change in pressure on your pelvic floor. These different changes are occurring, and it is going to become more difficult to stay connected to your core. However, that does not mean that you are just doomed. We can do things to practice and help remain connected to our core. So, what we're going to do is we're going to practice that connection breathing. The more you practice this, the better you're going to be able to manage that pressure in your core, help prevent unnecessary levels of diastasis recti, and also help protect your pelvic floor and just in general help with other, common pregnancy aches and pains. With connection breathing, it's all about thinking about our core unit as one full unit, which doesn't just, consist of, hey, look, a visible six-pack. No, we're talking about all of our core muscles. You'll specifically hear me talking about different core muscles as we go along here, like our pelvic floor, the muscles in our lower back and our diaphragm, TVA. It's more than just what we initially typically tend to think about here. These different muscles really all work together as our core unit, and we want that core unit to work in unison with our breath. So, the way that this unit works is when we inhale, we are filling our diaphragm with air. As we fill our diaphragm with air, that is actually going to push downwards and lengthen our pelvic floor. So on the inhale, diaphragm builds up, the core is relaxing, the core is coming out, the pelvic floor is moving down. On the exhale, we are pushing that air out of our diaphragm, and the diaphragm moves up, the pelvic floor moves up, and our core is wrapping inwards towards our body. I'll definitely go through an actual visual and show you guys kind of what this looks like, but just to kind of give you an understanding of what's kind of going on as well. Now we can coordinate this with your core unit. Obviously the breathing, the core connection, these movements between your diaphragm, your pelvic floor, your core unit as a whole, through specific training and just in general in our day-to-day activities. Now, practicing this exercise prior to strength training is a really great time to practice it, because it's not only, again, it's not just something that we're doing for pregnancy, it's actually something that's going to help you while you're training, while you perform certain lifting exercises. Staying connected to that core will not only protect your core, but it'll also, help manage that pressure. While we're lifting, we have a decrease of pressure in our core, and if we're not being mindful and appropriately managing that pressure, it can put excessive stress on these connective tissues. The linea alba, that's what holds your TVA or your core together. So we need to be very mindful, because if we have unmanaged pressure here excessively and frequently throughout pregnancy, and we're not managing that pressure, that can cause a lot of issues. Now, we'll kind of dive into things a little bit more here. There's obviously, some of that is just going to naturally be occurring throughout pregnancy, but, with physiology expanding in the abdomen to make room for this baby, but we can definitely do a lot to, again, mitigate and manage so that we're not constantly in excess. So, another thing that we have to think about when we're talking about managing this pressure is protecting the pelvic floor. Unmanaged pressure on the pelvic floor can also cause a lot of issues, pelvic issues, pelvic floor issues. So again, working through this connector breathing exercise before your lift and just in general it's going to help so much. Now, I would suggest that, about 2 minutes of connection breathing, breathing, the process of inhaling and exhaling, and getting a feel for how that entire core unit can work in unison is going to be extremely beneficial. So I will demonstrate and insert a video here of me going through this movement for you so that you can kind of get an idea of what that looks like. All right, so let's practice our connection breathing together. So I'm going to go ahead and demonstrate here. Obviously, not pregnant right now, but this is the same process when you're pregnant or not pregnant. So let's walk through this together. So our breathing starts with an inhale. So again, on an inhale, we are filling our diaphragm with air. We're not filling up our chest. We want to make sure that our breath is coming through the diaphragm, filling up our diaphragm and our belly and all around our core unit back, filling up with air. So relaxing the abdomens. Let's go through this. So with our breath, we want to, you can see how my stomach literally filled up with air here. It came all throughout my diaphragm. My chest did not raise. And through my back. Then on the exhale, you can literally see my pelvic floor is coming up and down. You can tell how that is happening here. So on the inhale, and then the pelvic floor will come up as we exhale. So I'll take you through a couple of reps without talking, just so that you can kind of see what that looks like without me having to talk at the middle of it. So. All right, that is how we do our connection breathing.